Hello everybody, today is the anniversary of the death in 1654 of Nicholas Culpeper. Perhaps not a well-known name, and he died at the young age, even for then, of 37. But he made a considerable contribution to the development of medicine. 1654 and the years leading up to it were a period when the medical provision in London and elsewhere in the country was really stretched, and a lot of physicians were making quite a neat little amount of money out of charging their patients. But Nicholas Culpeper decided that he was not going to charge, and he managed to avoid this by using an awful lot of herbal medicine. This was his priority, was to cure people with medicines that could be just procured from the countryside. And he had remarkable success, sometimes seeing up to 40 people a morning, and he wouldn't charge any of them. And what's more, he would see them. The physicians who charged for their services would sometimes simply ask for a urine sample and diagnose from that. Culpeper said that not all the piss in the Thames would be enough really to give a proper diagnosis, and he didn't want people seeing what he called these insolent, unsufferable physicians. He wanted the people to be treated by physicians who had seen them personally, who had talked over the situation, given them a proper diagnosis, and who were treated with medicines that were easily come by and cheap to procure. And he wrote books too. He wrote the best known one's called The English Physician, and he wrote it in English so that people could read it, whereas a lot of the physicians wrote their works on medicine in Latin, so they were beyond the ordinary person. In other words, he brought medicine to the ordinary person and saw medicine as something which was not a commodity to be sold, but a common birthright. I just couldn't help feeling how contemporary someone like Culpeper is in the challenge that he brought to the way in which many of us experience healthcare at the moment. I mean, the National Health Service is clearly completely different from the kind of opportunism sought by physicians in Culpeper's time. But we still struggle sometimes to actually see a doctor, and often are prescribed things without really knowing what they do to us and for us. But we can't complain. I have just this morning been at St George's Hospital for an injection to deal with the macular degeneration in my eyes. And without me soliciting the information, the consultant told me that each injection costs the NHS £800. And when you think, for one thing, that makes you realise just why it is that the NHS is so short of money. But it also makes me enormously grateful that kind of service is there for me and for others who have similar conditions, as well as for many people who have different conditions with equally expensive remedies. We are enormously fortunate, but we do have this fear that the expense of all these things is going to take the NHS away from the reach of ordinary people, either because of lack of provision, lack of resources, or because of a change of policy about how it's funded. And I think that we need just to be absolutely sure that we back the Nicholas Culpepers of this world, who want to make sure that medical care is a provision that is a birthright and not a commodity.